Hey, Elena. I have a patient who is a 54-year-old male with a history of CAD, and he had his non-STEMI about 3 months ago. He's a little bit overweight, and his LDL is 159 despite of being on atorvastatin 80 milligrams. The doctor wanted to start him on this newer medication for cholesterol. I think it's something like a PSK something. Do you know what I'm talking about?
Oh, you must be talking about the PCSK9 inhibitors. So there are a newer class of medications that are approved for primary and secondary prevention of atherosclerotic cardiovascular disease to lower LDL cholesterol and reduce cardiovascular events. So there are two currently on the market, evolocumab and alirocumab. Based on what you just told me, it definitely sounds like your patient would be a great candidate considering the fact that they have ASCVD, their LDL is really uncontrolled despite being on the maximum dose of a statin. So, all that being said, do you know if your patient has insurance or have you already checked to see if one of these medications would be covered by insurance?
I actually put in an order for one of the to the one of the patient's pharmacy, and the patient told me he wasn't able to pick it up. And I have to contact the insurance company. What exactly does that mean?
Hmm. It sounds like they probably need a prior authorization. So most insurance companies do require prior authorization for these agents, and it's basically requiring the prescriber to justify the necessity of the medication in order for the insurance to pay for it and cover it. So usually someone from the doctor's office or a specialized team of pharmacists and technicians will complete the prior authorization.
I'm familiar with that. I've submitted something similar for other medications. I can submit it and hopefully it will get approved, but I suspect it might be a little expensive or perhaps not cost effective for the patient. What's the average cost?
Yeah, that's a great question and can definitely be a really big barrier. So these medications are very expensive. They're about $300 to $700 per month, which translates into up to $9,000 a year. But keep in mind that is the cash price before insurance. So does your patient have insurance?
Yes, he does have a commercial insurance plan, but what if the copay is still high despite insurance coverage?
Yeah, so that's also a possibility. If the copay is still high despite insurance, they can use a copay card through the manufacturer. Now, keep in mind that these can only be used with commercial insurance. So, in your case, that would be fine. But, for future patients, just keep in mind that copay cards cannot be used with Medicare or Medicaid. So patients can sign up for the copay cards online. It's a pretty quick, simple process. And then they'll have to show that copay card to the pharmacy when they pick up the medication. So usually these will cover most of the copay, but not always.
What if I have a patient who doesn't have insurance or if the copay is still high with a copay card?
So there are some other options. So there's patient assistance programs available through the manufacturers. And if patients meet the eligibility criteria, they can actually get free drug from the manufacturer. The downside is this is a little bit more of an involved application process compared to the copay cards, but if done and if approved, it can really pay off. And these programs can be used for uninsured and underinsured patients. There's also several grants that are available through various foundations, and also certain health institutions will have financial assistance departments and programs that can help cover copays based on certain eligibility criteria.
It's good to hear there's some options. I thought I saw that these were injectable medications, and my patient is not particularly thrilled about that. Are they like insulin injection when they have to give it to themselves every day?
Yeah, so the good news is that they are a lot easier than traditional insulin injections. They are all injectable therapies, but there are a few options that patients can choose depending on their preference. So both of the PCSK9 agents are available in auto injectors, and this is the most commonly used formulation. So they're easy to use, they're single dose pre filled syringes. So I have one for you here, and they're deployed with the push of a button. There's no vials, there's no syringes to worry about, and the needle actually stays hidden in the auto injector. So it's never seen by the patient. And this can be really helpful in patients who are hesitant about using injectables or are worried about needles. These ones are administered every 2 weeks. There is also one other option specific to evolocumab. So this is also a single dose, but it's an on-body infuser, and it takes 9 minutes to infuse into the subcutaneous tissue. It's a little bit more complicated to use compared to the auto injectors, but patients can be appropriately educated on it and be successful with it. The good news is that that system only needs to be administered once a month compared to every 2 weeks with the auto injectors.
I'm sure it's helpful to have to increase adherence if the patient have options in saying their treatment and administration schedule from 1 week to every 4 weeks. What are some of the other important things I can educate the patient about?
Yeah, so these medications should be stored in the refrigerator. They can be taken out and put at room temperature and are good for up to 30 days at room temperature. So it does give them that flexibility. They should be taken out of the refrigerator at least 15 to 30 minutes prior to the injection, and that's to decrease any discomfort that would be associated with injecting a cold medication. So prior to the injection, patients should be educated to wash their hands, disinfect the area that they're going to be doing the injection in, and to ensure that the medication is clear so that there's no discoloration or cloudiness in the medication. They should select a area to do the injection, which they could either use a fatty site on either side of their belly, as long as it's at least 2 inches or more from the belly button, or they can use the top of the thigh. Also, if someone else is giving them the injection, they can use the back of the arm. They should be educated to rotate the injection site each time they do the injection. And then in terms of after the injection, so they should be educated to dispose of these products in a sharps container. So they should not be put in the regular trash. They should not be mixed with other trash. So they can either buy a sharps container from a pharmacy, or they can use some kind of household item that is very durable and cannot be punctured. So something like an old coffee tin or an old laundry detergent container. And then they'll need to contact their local waste management company to determine how to dispose of the sharps container. Some other things that patients might want to know that are good to educate them on would be side effects. So most common side effects are injection site reaction, so some redness, bruising at the injection site. And other than that, patients can see flu-like symptoms. But otherwise, they're pretty well-tolerated medicines. And one other important thing is in terms of monitoring. So I would ensure that the patient has another LDL checked about 4 to 12 weeks after starting one of these agents.
I just remembered my patient have a latex allergy, and I saw somewhere in the literature there's a concern about latex allergy. Can you explain that to me?
Yes, that's a great point. So one of the products, evolocumab, it contains a dry natural rubber, which is a derivative of latex. So in your patient, I would avoid evolocumab. The good news is that the other PCSK9 product, alirocumab, does not contain this ingredient and would be safe from this perspective. One thing to keep in mind, though, is that you may need to explain this to the insurance company in the prior authorization in case they only have the evolocumab product on their formulary and would have to make a special exception to approve the non-latex product.
But thanks so much for answering all my questions. I feel more comfortable with the PCSK9 inhibitors drugs.
Awesome. I'm really glad we were able to connect and talk through this. Sharing this information with the patient and helping to support them through the decision-making process is very beneficial. So, of course, we all know that medication management can be really complicated, but information sharing at the beginning can be really helpful. I know we've seen improved outcomes and evidence is backed by this research. So shared decision-making makes a huge difference.
I agree. I will bring this information back to the patient to help them feel more comfortable with the PCSK9 inhibitors. Thank you again.
No problem. Feel free to reach out anytime in the future if you have any additional questions for your pharmacist.